Kia ora koutou. Hello everyone, my name's Conal Smith. I'm a Senior Research Associate at the Institute of Governance and Policy Studies at Victoria University at Wellington. And I've been working on life satisfaction and related issues here and overseas and at the OECD in various roles since about 2002, 2003. What would be my policy priority based on the evidence we have on the drivers of subjective well-being and life satisfaction more specifically? So there's an extensive literature on the drivers of life satisfaction. I suspect that most of this audience are going to be aware of it, at least in its broad outlines. And we all know roughly what that says. Mental health matters a lot. Unemployment is one of the most negative experiences you can have in your life. Social contact is hugely important, and therefore loneliness has a large negative effect on life satisfaction. So based on this literature, my policy priority would be to see the systematic inclusion of measures of life satisfaction in program evaluations, and to see this done across government agencies in different countries and encouraged, incentivized by the finance ministries and treasuries. So this is I'm aware this is a very, very geeky, nerdy proposal that doesn't seem to draw on the big picture. Why is this my priority? So the average life satisfaction impact for different states, poor mental health, being unemployed, being lonely, being poor or well off, or even the cost well-being valuation of those states, which uses well-being measures to convert that into what an economist would call a compensating surplus or a compensating variation, is of limited actual policy utility. And there are 4 reasons for that. First, the marginal impact is not the same. A marginal impact of, say, a change in mental health is not the same as the average impact. Yet the estimates we have from most of the academic literature captures the average impact of this. So trying to inform your decision-making based on the average impact when what you're getting as change at the margin is potentially very misleading. Secondly, cost per unit of change matters just as much as the impact of a unit of change on the outcome on life satisfaction or subjective well-being. So from a policy perspective, we're interested in well-being per dollar spent, and that means we have to think about cost, and we cannot think about cost without actually thinking about the specific program you're funding. You can't go out as a policy maker to the local market and buy a unit of mental health or a job or a unit of loneliness or lack of loneliness. All of these things, what you purchase is a policy program. So we need information on impact which is tied to specific programs. Thirdly, the transferability of conclusions, even from a good program evaluation, isn't a given. We can't assume that what you would get from an initiative in putting people in social housing in New Zealand is going to be the same impact as it would be in America, as it would be in Germany. All the impact on life satisfaction depends heavily, almost entirely, on the context in which it occurs. So we need to know about specific programs in specific places. Finally, we've known since at least 2000, when Bruno Frey and Alois Stutzer published, I think, a very good paper on institutions and subjective well-being, we know that procedural utility matters. Even if our advice is good, advice from a bunch of experts on life satisfaction about what to do with policy is not the same as a process which is grounded in genuine legitimacy. The more democratic that process is, the more grounded it is in a process which engages people, the better the outcomes are going to be. So for all those reasons, I'm skeptical of policy priorities based on the broad life satisfaction data. The way forward, I think the thing that will actually help is program by program getting evaluations, and all of those evaluations having the OECD standard 0 to 10 life satisfaction measure in them. Real policy change tends to occur, 90% of it, at the margin and with specific programs. And I think the main thing we can honestly say, or that I can honestly say, that I think would improve outcomes, particularly if it's a generic piece of advice, not to the current New Zealand government in this place at this time, is to improve the quality of the decision making. And that means evaluating specific programs. And for scientists, social scientists working in this area, it means increasingly trying to publish articles that capture program impacts, not just the generic drivers of life satisfaction. Thank you. And I hope the workshop goes well.